I'm going to tell you a little bit about the HTAi Policy Forum and its recent discussions on HTAi and value. I think I've been put last in this group because whilst I'm going to say some things about how we define value and evidence it, I'm also going to say a little bit about how that might get used in decisions, so perhaps bridging into subsequent sections of the conference. So before I tell you about the forum's thoughts on HTAi and value, I just want to spend 2 or 3 minutes literally talking about the policy forum itself so you know who these thoughts came from. We know that HTAi is a leading international professional society for HTAi. It includes both the doers of HTAi and the users of HTAi, the people who use it in decision making. The HTAi Policy Forum is a venue for strategic discussions between leaders of public and private sector organizations who use HTAi for decisions in healthcare systems and industry. Brings together groups from industry and groups from HTAi and payer organizations. It meets every year for one main meeting that runs for 2.5 days. It's now addressed 10 major topics and published 7 papers, and there is a paper on the forum itself for those who are interested. I'm not going to go through this slide. This just lists the papers we have published in the International Journal of Technology Assessment on Healthcare, and we have just had accepted for publication our paper on HTAi and value, and that will appear in the autumn of this year, and it is now available on open access, pre-read on the HTAi website. So log in and you're welcome to read the full paper. As I said, there are 15 for-profit members, industry members of the forum, that's them listed, and there are 13 not-for-profit members, that's them listed. That's changing slightly as we go into the new year. It moves each year, but stays roughly that size. And that's an issue as we move forward. The members of the forum feel that the forum is of value, and they're keen to stay involved in its work, but also involve others in its work. We take the ideas generated in the forum and share them and explore them with other people through sessions like this, panel sessions at HTAi meetings and meetings around the world. And we hope in that way to stimulate a wider debate. We just heard from the editor of the journal that the last 3 papers from the Policy Forum are 3 of the top 10 most read papers in the journal over the last 12 months. So we seem to be hitting topics and producing papers that are of wider interest to the HTAi community. We can't make the forum meetings any larger, otherwise we'll lose the ability to get to grips and really dig down into an issue. So we're currently thinking how to roll the forum thinking out more widely, both through this kind of session, but also whether we can now roll the forum model out to other regions. And in the 2 days before this meeting started, we held a kind of experimental Asian Policy Forum meeting, which seemed to go very well, and I think we'll probably repeat within the next year, and maybe that can be rolled out further to other areas as well. So after that very brief introduction as to who the Policy Forum is, let me just try and pick out a few of the key points from its last meeting on HTAi and value. Do look at the paper if this interests you. Do come to the panel session on Tuesday if this interests you, where there'll be a much more in-depth discussion of this topic and the forum's contribution to it. So the forum discussion covered a wide range of issues, and I can't possibly do full justice to it in the few minutes left. But I'm going to try and summarize some of its thinking on these topics. What is value in health and healthcare? How do we measure or evidence value? And how do we use that evidence in decisions, in theory and in practice? I'm going to say a few words, because it was of great interest to the forum, and we spent a lot of time on it, on how do we value innovation, and what is the relationship between HTAi and innovation. And then I'll say a few words about what the forum thought could be done to try and improve the way we do things in this area. So what is value? Well, the first point we noted, of course, is that definitions of value vary. Even the way we use the word value varies. So I may say, what is the value of this technology? you ask me to you understand that I'm asking a question about the absolute value of the technology. If I say this technology is very good value, you understand me to mean value for money. So even whether value means value or value for money actually varies according to the way we use the word. This can cause confusion. We noted that different stakeholders undoubtedly see value differently. Value is, as they say, in the eye of the beholder. And we heard in the forum, very clearly, we heard views expressed at our invitation from patients, from people speaking on behalf of the wider society and the public, from health system decision makers, and from industry. We noted that whilst these definitions of value all vary, they do all seem to agree that the core of value is health benefit for the patient. And we felt that you could build a model of value which had that at the middle and then had other circles around that. So, for example, the wider elements of value, other benefits for the patient. They might be financial, they might be convenience, they might be reduction in uncertainty or anxiety, choice. There are benefits for the caregivers and the family, the social circle immediately around the patient. There are benefits for society as a whole. We might see these in terms of overall public health benefits, improved productivity, which Sir Michael talked about, support for the needy disadvantaged groups, economic benefits. And finally, there are benefits for the health and social care system, which might be in terms of improved quality of care, cost efficiency of running the system. So we felt core of value, patient health. We then moved on to say, how do we evidence these things? How do we collect evidence? How do we measure them? And we noted that, there was a lot of variation here. So even in the core element of patient health, there were different approaches. There are ways, obviously, of measuring clinical outcome. You can look at survival, you can look at symptoms, you can look at functioning. Some people say, I'm not just interested in clinical outcomes, I'm interested in overall health. And there are instruments which try to collect evidence on overall health. EQ5D is an example. And some people say, I'm not just interested in a simple state, I want some kind of integrated measure of overall health and time. So health gain, in other words. And then we've got QALYs, and if we look at it from the other way around, we've got DALYs. So even in terms of measuring the core element of patient health, we've got a wide range of approaches to doing that. And when it comes to those wider elements of benefit and value, then there's a much wider range of approaches to how you might do them and discussion about the appropriate methodologies. So that's the first point we noted. The second point we noted was that not only is there a wide variation in how you might measure and collect evidence, the measurement does not in itself give you a value. You have to attach a valuation to those measures. So a health state does not give you a value for the health state. You can either do that by looking at clinically relevant differences, is one approach. You can do what the German, French, and many other systems do, which is to try and categorize changes in health state or health outcomes into particular groups: major improvement, small improvement, minor improvement, no improvement, often defined much more carefully with language ladders, as they call them. Or you can take the approach which Sir Michael referred to in his talk of formally attaching utilities, so for example using the QALY. So I think what we felt at this point in our discussions was, gosh, this is complicated. Value consists of many different things and elements. Each of those elements can be measured in a variety of ways, and there's not consensus necessarily on how we do that. And each of those measures can be valued in a variety of ways, and there isn't always a consensus on how we do that, and different systems choose different ways. So at that stage, we began to, kind of feel that our heads were hurting. We moved on to try and look at, well, in this very complicated world, how do you actually go about making decisions? We noted, in a way, some obvious things. Decisions are made at many levels in the healthcare system. Decision makers in healthcare systems tend to be interested in the real world of healthcare, of their system, of the disease they're trying to deal with, of people with comorbidities, all the things we've heard about this morning. Decision makers are increasingly trying to focus on value, and typically on incremental value over alternatives. If you're a decision maker, you're not looking at the abstract, you're looking at the choice of something over something else. We noted that in almost all countries, possibly all. Decision makers are interested in costs, even if they say they're not. And we noted also a trivial point in a way, that decisions, as I've just said, are very complicated. As a decision maker, you're trying to juggle a whole lot of evidence about different elements of value and to people, and many other factors. And so we noted that decision makers tend to use a mix of formal processes and deliberative processes. As Sir Michael said, these things can't all be reduced to a number, but some people, they vary. Some people try to put some elements into a number and then factor in the things that they haven't put into the number. Some people try to put more things into that number and reduce the number of things that are in the objective, the subjective field. Other systems basically put almost nothing into a number and just put everything down on the table as a range of factors which they try to decide about at the same together. We then looked at some practical systems from around the world, a quality-based system, the French system, and the German systems, which tend to look at clinical added benefit. We noted, in a way, how different they are, but we also noted when we came to look at how value is put into decisions, actually, in some ways, they're also quite similar. They all focus on patient health as the core of their decision and factor in the wider elements of value as they go along. They all use a mix of formal and informal methods, and they all use judgment. Absolutely no doubt about that. And we wondered whether actually there might be some elements of convergence. The systems that have previously looked at clinical added benefit are now increasingly looking at cost effectiveness, and the systems that use QALYs and perhaps used to use them quite rigidly are increasingly looking at adjustments and other factors which are not actually terribly different from the kind of things that the clinical added value systems look at. So possibly some convergence going on there. I'll very quickly skip through the look that we had at value, innovation, and HTAi. We asked ourselves the question, is there value in innovation in itself? Of course, innovative treatments may produce better outcomes in the short term, but is there value in innovation? Well, we thought there were three reasons why there might be a value in innovation beyond the immediate benefits you can see that it delivers. The first is that we may not fully understand the long-term benefits of a product at launch. The second is that technology and/or the application of technology develop post-launch. So an innovation may produce more value later down the road because of the way it develops. And the third point we felt that might give value to innovation is that a technology may provide a certain level of benefit, but it may provide a platform on which further technologies can build, which without that platform you wouldn't have got that building and you wouldn't have got the further value. So that raised the question, can we assess and define the promise of a technology? And we noted, actually, interestingly, that when technology assessment first started in the United States in the 1970s, it was very much a kind of policy science that was about trying to understand the future impact of technology. It's become a very different thing. So we kind of thought, well, maybe we can do that, but we don't have the methods at the moment. We had some kind of interesting discussion about could there be more of a partnership between healthcare systems and industry, concept of pro-reimbursement, whereby we could jointly develop and assess technologies, perhaps joint risk-taking, perhaps even joint investment. But then other people in the discussion said, yeah, hey, but hang on. Actually, society is already providing a lot of public support for innovation. The whole of the public R&D system, the tax incentives, the IPR systems. There's a lot of help that we give the innovation system. So we should be careful about what else we do. So we noted, going back to more mundane things, that as we've heard from other presentations, investors and innovators make large investments on long timescales. We in the HTAi and the health system community need to give them clear signals about how we are going to measure the value of their products. And that means we need better agreement between HTAi bodies about what value is and how we measure it. It would be really nice if we could get better agreement between HTAi and regulatory bodies about what value is and how we measure it. And maybe we should be focusing initially on the core elements of value, the health outcome for patients, but it would be really nice if we could also, in due time, begin to think about getting greater consistency in the definition and measurement of the wider elements of value. Of course, how they're used in decisions will always vary. So, my final slide, what could we do about all this? Well, the forum thought it would be useful if we could continue, the community could continue to work on developing a clearer general framework for the definition and assessment of value. Can we continue this discussion and try to get a better agreement between all of us, HTAi agencies, regulators and the like, about what we mean by value? What's the core? What are the wider elements? How do we define and measure all of those things? That's a very abstract exercise, and we thought it was very important to carry on with the work that's going on at the moment on giving greater detail on the measurement of value for specific disease areas. So guys, if you're going to produce drugs for Alzheimer's disease, which will be fantastic, let's be clear what we are going to value in those drugs and how we're going to measure it and what you're going to have to do to prove that. We thought that we should continue to provide scientific advice, as we've heard about. We felt that someone ought to be exploring the relationship between HTAi and the developments that are going on in progressive and adaptive licensing, and I'm absolutely delighted that the forum has agreed to pick that up as its next main discussion topic. And finally, to echo a point in the last presentation, we felt that we should continue to work on the question of how we can tailor HTAi and coverage procurement decisions to be appropriate for medical devices as well as pharmaceuticals. So thank you very much.
Thank you, Chris.